Section 411 is establishing a public option for health insurance. And I guess we should just clarify what exactly is a public option. This would be a government-run health program, and every American would have the ability to choose from that program or private insurance. Private insurance wouldn't be prohibited. This would just be an option for a government-run health program. And a public option has a number of benefits. Some of them include the fact that because it's government-run, it's nonprofit. Private health insurance companies make tremendous amounts of money. Government programs wouldn't have that same drive. Also, because it's a nonprofit, there'd be no taxes to pay, which would also help keep costs down. In general, administrative costs would be lower than with private insurance. Their administrative expenses were $4.5 billion, or 1.1% of their total costs. 98.9% of expenses went to benefit payments. And if you compare that to private insurance, they pay 80, 85%, maybe as high as 90% out in benefits. But the program would also have better bargaining power to compete with private insurers, because it would be one national negotiation. While the government may be incompetent on some things, if we can provide cost savings to the American people, as well as provide these other benefits through a public option, I think we absolutely should. Other benefits are this would be portable. This is billed as part of the American Union's job program, that as every American gets an American Union job with an universal basic income, they also get the opportunity to buy health insurance, which they can take with them no matter where they are around the country. Give Americans the freedom to move around the country and have insurance and income move with them. What do people think about a public option? And the vast majority of people support it. The March 2021 Politico survey found that 68% of voters supported a public option, a higher percentage than supported a Medicare for all. And so this is incredibly popular with the voters. Now, this section 411 is based on previous legislation that has been introduced in Congress, and it would add a new section to the Affordable Care Act. And just to kind of go through some of the details briefly, the Secretary of Health and Human Services would be responsible for putting together the public option and the specifics of the plan. Beginning in 2024, they would be offered through the healthcare exchanges that the Affordable Care Act set up. I also want to emphasize that the public option would be voluntary. No one would be obligated to buy their insurance through it. And the legislation says so specifically on page 99 of the blueprint, that participation in the public option is voluntary. The Secretary would put together a number of plans, a standard bronze, silver, and gold. If you've shopped for health insurance on the exchange, you're familiar with those. And then there would be an option for a platinum plan, depending on how costs and things work out. Premiums could be geographically adjusted, and premiums would be set in an amount to cover the cost of administration and health benefits. So figure out what will it cost, and then set the premiums at that, plus a 90-day contingency margin for unexpected expenses. And so these startup costs would be the 90-day margin plus $2 billion, and that would be repaid over 10 years. So this would be a cost neutral to the rest of the federal government spending. There would be no bailouts, another thing that specifically is specified in this legislation. This would be a completely separate program, self-funded, to provide health insurance to anyone who wants it. The public option would also require negotiation for prescription drugs. It would set up a provider network. As the default, any hospital or any doctor who participates in Medicare right now would be included, but they would have an option to opt out after the program gets started. They start working out details in 2023. Doctors and hospitals would have at least a 4-month window to opt out, and then an annual enrollment period where they could change their status. The reimbursement rates, payment rates under the public option would be set at the Medicare reimbursement levels, plus there'd be a 5% incentive bonus for the first 3 years. Physicians would be divided into 2 classes: the preferred, who agree to accept this payment rate, and then participating non-preferred physicians, who agree to cap their charges at 15% over their in-network cost-sharing price. And then, anyone else, any other physicians or doctors who didn't want to participate would be non-participating. Subsection D of this section, it offers options for the secretary to experiment with different reforms and ways of bringing down healthcare costs. Some of the policies that they could try would include patient-centered medical home care. It would accountable care organizations, value-based purchasing, bundling of services, differential payment rates, performance or utilization-based payments, a fixed payment per person, or direct contracting with providers. And the secretary could try these out in different locations and sort of see what works. And then if they, pick out the best plans and expand them, roll them out nationwide. Anything that they tried under these provisions would have to, quote, promote care that is integrated, patient-centered, high quality, and efficient. In addition, it would also have to be aimed at least one of these 5 targets: improving health outcomes, reducing health disparities, including racial, ethnic, and other disparities, providing efficient and affordable care, addressing geographic variation in the provision of health services, or preventing and managing chronic illnesses. Any experimentation would be targeted at least one of those 5 things. Other subsections in this part, they include protections for individual health information. The same protections that apply to other health plans would apply to this too, including HIPAA. And so overall, this would give the American people another choice. There's a lot of reasons for people to be dissatisfied with healthcare in this country. As a nation, we pay more per capita than any other country on the planet and leave tens of millions of people uninsured. So, and the logical first step to be a public option, since our president has already promised us one of these, and we saw at the start of the pandemic, some more than 5 million Americans who lost their health insurance coverage when their jobs went away. We need a better model for healthcare in the 21st century, and by decoupling employment and insurance, seems like a logical place to start.